Hello everyone. Today we are going to discuss about secondary attack rate SAR, and I am Dr. Anusha, Assistant Professor in the Department of Community Medicine. Before going into secondary attack rate, we will see some epidemiological terms: index case and primary case. Index case means the first ever person who got the particular disease. Say for example, COVID. So first person who got COVID. That means we should trace back. So we thought that it started in China, Wuhan. So in Wuhan, first who got that COVID will be the index case, and sometimes we can trace the index case and sometimes we cannot trace the index case. And primary cases, the first person who got the disease, but it will change according to the context we are talking about. Say for example, if you are talking about a family, in that particular family, first who got the disease will be primary case. And if we are talking about a school, in that school, first who got the disease will be primary case in that school. And if we are talking about a community, in that community, first person who got the disease will be primary case. So this primary case will change according to the context we are talking about. And now we will see what is secondary attack rate. So it is number of exposed persons developing the disease within the range of incubation period following exposure to primary case. So simply, so it is nothing but from primary case, how many others are developing the disease secondarily. So from primary case, how many secondary cases are developing. So we will see with some examples. So here in the image, a family of 4 is given. So in that, the orange one is the primary case who got the disease. So to this orange person, other blue persons are also getting exposed. So from this primary case, how many others are getting disease? In that blue people we will see, and they will show signs and symptoms only after incubation period. So after incubation period, from that primary case, how many secondary cases are developing? So in that second image, so from that primary case, two other also became orange. That means from that primary case, two others developed, so as secondary cases. So this is secondary attack rate, and now we will see how to calculate it. Secondary attack rate is denoted by SAR. So formula for SAR is equal to, in the numerator, number of exposed persons developing disease within the incubation period. That means how many persons got disease secondarily, by, in the denominator, total number of exposed or susceptible contacts. That means total who got exposed or total how many are susceptible. So among the susceptible people in the denominator, how many got disease within the incubation period into 100. So this is secondary attack rate. So in the numerator, we will only add secondary cases. We will not include primary case in the numerator. And also in the denominator, total how many are exposed or total how many susceptible contacts. Generally, when the data is available, we should take only susceptible contacts. Susceptible contacts means those who are susceptible to infection or disease. That means they are not immune. They are not immune. But for that, to know the susceptible contacts, we should know their immunity status, and we should know whether they are susceptible to that particular disease or not. And again, in the denominator also, we are not including primary case. So in the numerator we are not including, in the denominator we are not including the primary case. So among the susceptible or exposed people, how many got disease will be the numerator, and total how many got exposed or susceptible will be the denominator, into 100 will be the formula for secondary attack rate. Now we will see the example with calculation. And here we are calculating with the example of measles outbreak in a family. And this secondary attack rate will be useful for especially short period infectious diseases like measles or chickenpox. And this will allow the precise tracking of household spread. Why means, if the incubation period is 1 week, 10 days, 15 days, 20 days, we can track from that primary case how many secondary cases are getting developed. But if the incubation period is months, years, say for example 5 years, from primary case We should follow up for 5 years and then see how many secondary cases are getting developed. So it is practically not feasible. So the secondary attack rate is useful for short period infectious diseases. And here in the example, in that household, total, sorry, it is not 5 members, 6 members. So mother, father, and 4 children are there. Mother, father, and 4 children are there. Among those 4 children, one child got the infection or the disease, measles disease. And from that child, other 3 children are also susceptible because parents are already immune. Either they got the infection or they got the vaccination. That's why these parents are immune, so we are not including them in the denominator. So among those 4 children got exposed, only 2 children got infection. So 2 children got measles disease. So among those 4 children, 2 children got the measles disease. So 2 will be the secondary cases which will come in the numerator, and in the denominator, because we know the susceptibility status of that family. So because in that family only 3 children are susceptible, so 2 in the numerator are secondary cases and 3 will be the denominator because only 3 susceptible contacts into 100. So it will be 66.6%. But if we don't know the immunity status, we should take all exposed persons. But when we have idea about susceptibility status, we should only take number of susceptible contacts in the denominator. So here 2 secondary cases by 3 susceptible contacts into 100. 66.6 will be the secondary attack rate. So 66.6 means it is high. So SAR of 66.6 indicates high communicability within closed aggregate. Closed aggregate means within the same house, within the same family, within the same classroom. So here SAR for measles is more than 50. That means among the exposed susceptible contacts, more than 50% will get the disease. So that means high communicability. Now we will see what are the applications of secondary attack rate in public health. So it will tell about the household spread of a particular disease. That means in the closed aggregates like families and households, from primary case how many people are getting affected, getting disease. And it will also tell generalized disease communicability, disease spread. If it is unknown disease also, we can see if the secondary attack rate of that particular unknown disease is more than 50%, means among the exposed contacts more than 50% will get affected. If it, say for example, if the secondary attack rate is 50%, among 10 exposed persons 5 will get the disease. If the secondary attack rate is 20%, 1 among the 5 affected people will get the disease. So it will tell about the disease spread. And it will also help to evaluate the effectiveness of control measures like isolation. So if we are doing isolation, it should decrease the secondary attack rate. And it will also be useful in assessing vaccine effectiveness. So if after the vaccination, also these people are getting disease or not. If they are not getting disease means, even though they are exposed and they are not getting disease means they are not susceptible. So they are not susceptible means they got immunity. They got immunity through vaccination. That means this vaccine is effective in controlling the disease. And what are the limitations of secondary attack rate? So it is a big task to identify the susceptible contacts. How we will know the susceptibility status? Unless we do the blood test and we see the antibodies to that particular disease, we will not know the susceptibility status. So identifying the susceptible individuals itself is very challenging. And so if we are not knowing the susceptibles, then we are keeping in the denominator all exposed persons we are including. That means it is increasing the denominator in that secondary attack rate formula. So if we are increasing the denominator means that secondary attack rate percentage will decrease falsely. So that is the problem. And one more problem is presence of subclinical cases. So even though from primary case others also getting disease, that persons may or may not be showing the symptoms and signs properly. If it is a subclinical case or asymptomatic case, then we are missing that case in the numerator. So that will also decrease the secondary attack rate. So what is the solution for this subclinical case means mass means we should do the lab test to confirm the disease, and then only we can identify it as a case, and we should keep in the numerator in the calculation. So identifying the susceptibles is a problem, and because of subclinical mass we are not seeing all cases. This is about secondary attack rate. And one more thing I forgot to mention is for short incubation period diseases, the formula is this. So number of exposed person who are getting the disease in the numerator, and total how many exposed or susceptible contacts in the denominator into 100. But if it is a disease with long incubation period, say for example tuberculosis or leprosy, long incubation period, it will be years. So in the denominator will change in the calculation. So in the denominator, the person exposure weeks or months or years will be the denominator, and numerator will be same and into 100. Thank you.